Are you frustrated from walking into the ER with chest pain but walking away with no answers? As an ER nurse, I probably see at least one patient for every shift that I work finding themselves in this scenario. If you are concerned about chest pain, it's always best to get it checked out to make sure that you don't have anything life-threatening going on, like a heart attack or an aneurysm. So if you go to the ER, you're gonna want to get at least a couple of EKGs to show what your heart rhythm is at the moment. The ER doctor will also want to know what your troponin levels are, which are gonna detect damage to your heart muscle, and they'll take those 2 different times. And the doctor may possibly want you to have a CT to check for aneurysms and blood clots. But if the doctor doesn't see anything concerning from these tests, then they'll send you home. If the doctor thinks it's a possibility that there may be something else going on, they'll probably order you a stress test or a continuous heart monitor that you'll wear for several days, or even order you an echocardiogram, which is just an ultrasound of your heart. I like to tell patients, though, that just as our brains are the centers for logic, our hearts are the centers for our emotions. And our hearts are very susceptible to stress and environmental factors. But please note that this is not a way of dismissing what you're feeling with your chest pain. In fact, I feel that this acknowledgement actually has the opposite effect. So when our bodies act up, it presents us with an opportunity to reflect on what's going on in our lives and how all of these things are truly affecting us. When working with patients with chest pain, especially younger people, I like to ask if anything big or stressful has happened in their lives recently. And I've found that almost always the answer is yes. I have a particular patient scenario that stands out to me that illustrates all of this that I was talking about. So I had a young woman with chest pain come in. I kind of sensed that maybe there was something else going on as well. So I went ahead and asked if there had been anything big or stressful that's happened recently in her life. And this was just what she needed to release the emotional gates in her brain, her heart, whatever. And she started crying. So it turns out that she had been dealing with a broken ankle for a few weeks and kept having all these complications from it. She was having some stressful family events at the same time. I went ahead and just sat with her in that ER room and told her these things about how much our hearts are affected by what is going on all around us. She was so grateful that I chose to take the time to ask her and sit with her, and she thanked me very much. Her mom was actually in the room too, and she thanked me as well. And I felt really good about this visit, like, hey, maybe I actually really helped someone today in a different way than what most people would expect by coming into the ER. And turns out that I was right, because 1 week later, I got a phone call from our ER secretary saying that I had cookies delivered with my name on them. So she had thought of me and wrote a really sweet note and had nice cookies delivered to me as a way of saying thank you. I just want to tell you that if all of this story applies to you and you know that you are feeling chest pain, you know that something is going on, even though you're not getting any helpful results from tests, I want you to know that you're not crazy and you need to give yourself some grace for all that you're probably dealing with in life. And remember to listen to what your body is telling you.